Okay, good evening, everyone. Thank you for joining our webinar this evening. My name is Anna Cable, your moderator for the evening. And we're going to go ahead and get started here so that we can be sure to wrap up by 9 p.m. Eastern. So thank you to all of you who have joined us this evening and are streaming from our YouTube. And I'd like to first invite Margaret Pichardo. She's our co-chair of APHA's International Health Student Committee, to say a few words of welcome. Margaret, if you can go ahead and take it away.
Thank you, Anna. Welcome, everyone, to the IH Student Committee webinar. It's a pleasure to have you on board. Listening to thank our three speakers for giving us an hour of their time to share their wonderful experiences in global health. And many thanks to you participants and listeners that have joined us tonight to learn a little bit more about what global health is, transition from school to the work field. I would like to say that our larger leadership committee is super excited that so many students and young professionals are engaged and motivated in participating through these webinars and with APHA overall. So many thanks, and I hope you find this webinar extremely useful. Please email us any questions through our apha.ihsc@gmail account, or you can tweet us questions and we will, once the speakers have their Q&A. Again, many thanks, and I'll leave it up to you, and again, to take the floor and introduce our first speaker.
Okay, great. Thank you, Margaret. So now let's get started with our first panelist. Dr. Sarah Blythe Ballard is an aerospace and preventive medicine physician who is in the U.S. Navy and is currently conducting research in Peru on pediatric diarrheal diseases on a Fulbright Award. She's calling in this evening from Liberia, actually, where she's providing leadership on the Ebola response with the International Medical Corps. Sarah Blythe, I'm going to turn the floor over to you now.
Okay, thanks so much for having me. Let me pull up the PowerPoint real quick. All right. So hopefully you can see the PowerPoint for those of you who are joining with video. Thank you very much to the moderators and everyone participating in this. I hope you find it useful. I'm going to be very informal and stick to the 10-minute timeline that was provided so that we can have some time at the end for questions. My email address is up right now. It's thenavydoc@gmail.com if anybody has any questions afterwards. And like the moderator said, I'm joining from Liberia, so our internet is a little shaky out here. So if the sound goes out, please just don't hesitate to cut me off. Like she said, my name is Sarah Blythe Ballard. I'm an MD, MPH, and I think my experience in global health has come about in a kind of roundabout fashion. So I completely relate to the many people out there that are interested in global health but really don't know how to get into it or have a lot of options and are trying to figure out the best way to do it. I was actually originally going to be an interventional radiologist, and I went to medical school on a Navy scholarship thinking that I would go straight into residency and then practice in radiology, and things were going to be, you know, very stable and, you know, according to plans. And when I joined the Navy, everyone has the opportunity / requirement sometimes to do a tour as a general medical officer, and one of the options there was a flight surgery training. So when I found out, and at the time when I entered, nobody was going straight into radiology from medical school. So I took a little detour and went to flight surgery training, and that flight surgery training ended up bringing me to Afghanistan and Iraq, which was not at all what I had expected. But I actually was very fortunate in that I had some leadership who were very open to me exploring different aspects of the military and being able to collaborate with people in the field not just military folks, but folks from State Department, folks who were NGOs in the field helping to do some of the reconstruction in Iraq and Afghanistan. So that was kind of my first introduction to global health in the field. We'll go on to the next slide. So from there, I guess my experience has been just a lot of unexpected opportunities that ended up coming together in kind of a strange way in order to kind of put me where I am today. I was interested initially in tropical medicine and ended up doing some coursework through the military, and then I learned about Johns Hopkins coursework in tropical medicine. So started going down this path, and the further I went down the path, the more interested I got. And so I decided to stay and do an MPH at Hopkins. I did the distance program because I was living in Hawaii at the time with the Navy, and we were deploying out of Hawaii. So the distance program worked really well for me, and it was really cool because I got to meet a lot of people who were also kind of in my same situation in the field or doing other things and couldn't be there full time. So that was kind of my first path towards a bigger career in global health. So when time came for me to end flight surgery, I really enjoyed the MPH program, and I talked to the Navy and kind of worked out a drug deal with them. If they let me go to residency at Hopkins in preventive medicine, then they would give me a deferment for a couple of years afterward, and I could go, continue to do my studies from my MPH and work on a PhD in global disease epidemiology. So that's kind of what allowed me to further the whole path into global health. So while I was in residency, I was also very fortunate to be able to do some overseas rotations. So I went to Peru for 6 months of my practicum year and was able to do my epi rotation there, and then also my clinical preventive medicine rotation there, and ended up doing a study in a recruit population, a Peruvian recruit population up in the jungle in Iquitos. And during that process, got to know a lot of the people who were working in Peru, both inside and outside of the U.S. government and the Peruvian government, and that kind of opened the door for further work in the field. So when it came time for me to do, I finished my residency and I'm looking for some funding to be able to stay overseas and complete my thesis proposal, which is in diarrheal disease in kids under the age of 5. So two of the programs that have been really amazing in supporting students in a similar position are the NIH Fogarty program and then also the Fulbright program. So the NIH Fogarty program takes both students who are doing their doctoral degrees and then students who have already graduated and are termed postdocs. So I did it through the postdoc program. They end up giving you a stipend to live abroad, and then they give you funds for research as well. So I did Fogarty for a year in Peru, and while I was there, I applied for further funding through Fulbright. Now, it's a little confusing because there is actually a Fogarty Fulbright Fellowship, which is kind of, it's separate from the NIH, from the Fogarty, from the pure Fogarty or the pure Fulbright. But if anybody wants to find out more about that, I'm happy to talk about that offline. So, but anyway, so these programs allowed me to stay in Peru a little bit longer to work on my thesis research while I was in this, deferred from active duty status from the Navy. And so my current work in West Africa kind of came out of nowhere as well. I learned about, I got an email message from OFDA, from the Office of Foreign Disaster Assistance with the State Department, requesting, physicians and nurses and healthcare workers to go abroad and work on the Ebola response as volunteers. So I sent in my CV. I talked to my advisor. I talked to, the folks in Peru, and told them I was really interested in going, and I had the time, and they really needed people, and so they agreed for me to go for a short period, a 6-week period initially. So then I went to Liberia and was helping to run one of the ETUs, the Ebola treatment units, in the county, in the rural region of Liberia. And the kind of neat thing about this experience was that I showed up in the airport in Brussels, and I ran into a couple of folks that I knew from Hopkins, a couple of folks I knew from the CDC. It ended up that the lab that was providing support to our treatment unit was actually a Navy entity, and some of the folks, it was really small. It was 4 people in the jungle, and then 4 people in Monrovia, the capital city. And the folks who were in the jungle were some folks that I had worked with in Peru. So it ends up being a really small community once you go abroad, and it's kind of cool because no matter what kind of uniform you're wearing or what exactly your background is or where you're coming from, everybody kind of is in the same boat, and there's a lot of collaboration in the field, which is very, very cool. I really like that about global health. So I couldn't give this presentation without telling you that there are a lot of challenges in this kind of choice in this line of work. Challenges for me have been, you're moving around a lot. Things are very unstable in terms of funding, in terms of your long-term career goals, where you're going to get money to do research, where you're going to be living, a month, 6 months, 1 year, 5 years, 10 years down the road. For me, it's been challenging challenging and rewarding to have affiliations with so many different entities, both the military, the NIH, State Department, then with an NGO, International Medical Corps, while I'm deployed right now, and then being able to kind of try to work them all together into a big overall strategy. So it was kind of weird because I had I went back to Peru from Liberia in, I guess, mid-January, and then I got a call from them again saying, well, State Department is giving us this money, and they really want us to implement an air ambulance system for Ebola downrange, and we're really looking for someone who's had experience in aviation and experience in tropical medicine and who has had experience already in the field of Ebola. And I was like, wow, that sounds perfect for me. So I ended up coming back. So I'm here for another couple of weeks. We just got the helicopter yesterday, and we're outfitting it tomorrow, and then we should start doing missions in West Africa toward the end of this week. But it's just kind of one of those weird things that if you kind of have an idea of what you're interested in and pursue the things that make you an expert in those areas, that eventually a door will open, and you may not expect it, but if you're ready and prepared, then things kind of come together. So I was very fortunate. I never thought I would be able to combine tropical medicine with, aviation medicine, and I was fortunately able to do that in this case. So that was pretty. That's a pretty short overview. We can go into more in the question and answer session, but I'll go ahead and turn it over to my colleagues, and I'm sure you'll get a very interesting and different opinion from all of them. So thank you very much for having me.
Okay, thank you very much, Sarah Blythe, for sharing your experiences. And if anyone had difficulty with seeing the slides, we can definitely send out the presentations at a later date to everyone who's RSVP'd, so not to be concerned there. And so I just wanted to remind you again that we are monitoring our Twitter and email. If anyone has questions, Sarah Blythe did mention Q&A at the end, so just want to remind everyone to send in your questions, and we'll get to as many of them as we can. Okay, so now on to our next panelist. Dr. Ruth Namuyinga is a preventive medicine physician who is currently an officer assigned to the malaria branch of the CDC's Epidemic Intelligence Service, where she provides technical support to the President's Malaria Initiative and technical assistance domestically and abroad. So Ruth, thank you so much for joining us, and I'm going to go ahead and hand it over to you now.
Thank you. I'm happy to be here. Hi to everyone. So, like the introduction says, my name is Ruth. So I'll just briefly go through my presentation. So my story is a bit different from Sarah's. I come from Africa, where I was born and raised. I graduated medical school there, and during this time I became increasingly curious about population health versus traditional clinical medicine, mostly because the patients could not afford care. But then I didn't really know what population health was. So I decided to pack up a bag and head to the United States, pretty certain that I would find the answers that I longed for, and then, all would be well. When I got here, I was blown away by the varying educational backgrounds of my classmates in the MPH class that ranged from health professionals to lawyers and social workers. And by then, the class looked like a little United Nations with people from all over the world, all huddled up in one classroom. It was my real first experience with what on the surface looked like, a great diversity. And yet I realized that with time that many of us were motivated for a passion for global health. This was at first exciting, but later raised more questions. It was fascinating to hear about people's travels and pursuits. I became increasingly aware of the endless options in the field of global health as the year rolled by. But where I thought I would find the answers, I only got, more confusing. What did I really want to do? So when you still do not know what when you still think you haven't found what you're looking for, you may become a student again. So this time I decided not to pursue another degree and instead decided to set up multiple coffee dates with my professors, alumni, classmates, and other public health professionals at the School of Public Health at Johns Hopkins. So from them, I learned a great deal. But one individual stood out from the crowd. We met, our meeting was unprecedented, and, in talking to him, he seemed really fascinated about, what he was doing, and he was really enthusiastic as he spoke. I do not remember a word he said, but he did mention that he was a former EIS officer, and that really stuck with me. At the time, I hadn't heard of the EIS program, and I hadn't met anyone doing that work. But then along the way, I started to meet many different people who had been EIS officers, and that drove my curiosity to learn more about the EIS program. So once again, I decided to look for answers, but this time I moved from coffee dates to my laptop. I read about the EIS program and realized that having a medical degree in itself is not enough. You need at least 1 year of clinical training, and that led to my pursuing preventive medicine residency, because I'm really interested in population health, and this really matched my interests. So in preventive medicine, you go through these different rotations and you meet all these different alumni, and as I spoke with them, I began to understand that EIS officers are also known as disease detectives. So they follow clues, to find a solution for a medical mystery. Some spend long weeks or months out in the middle of nowhere collecting data or samples, and I figured out their shoes must have been worn out at the end. And yet what they all had in common was during their work, there was a blurring of borders. It was really global health. Everyone in whatever they did worked in all parts of the world. So by the end of residency, while my colleagues weighed different job options, I pretty much knew what I wanted to do, and that was to be an EIS officer. Well, I keep mentioning the EIS, or Epidemic Intelligence Service, but what is it? So EIS is on-the-job training for health professionals interested in epidemiology. There are several components to training, with officers learning how to conduct epi investigations, do research, and surveillance. So officers, when you get into the EIS program, depending on your interests, you can do more work on infectious disease, chronic disease, environmental health, occupational health, injuries, birth defects, or developmental abilities. So what you work on is really based on your interests, and the projects differ. You can put as much energy in whichever one you desire. So when one is an EIS officer, you can be assigned to either the CDC headquarters in Atlanta, or in the field in state and local health departments, or with other federal health or federal agencies like the CMS. So I am centered at CDC headquarters in Atlanta, but several of my colleagues are out in the States and they love it, and our work is similar, though there are some differences when you're out in the States versus headquarters. So I've worked on I started last July in 2014, and I've been involved in many projects that seem more like adventures than really work, because you get to enjoy what you do so much. So like Sarah, I've worked on the Ebola response, but I worked in Sierra Leone, and I worked with the epidemiology team, and we set up an epidemiology base in one of the rural centers in Sierra Leone. And I've also worked on malaria work in many sub-Saharan African countries. So I've worked in Malawi, where I set up a study on case management of malaria, pneumonia, and diarrhea. I've also worked in Rwanda, looking at their surveillance system, and I'm currently working on multiple projects in sub-Sahara. Other aspects of training include, you learn about making presentations to a scientific audience, teaching, conducting analytical projects where an EIS officer is the lead for an EPI investigation from start to finish. We publish journal articles as first author in manuscripts, and the MMWR, which is the weekly morbidity and mortality report by the CDC, which reports timely public health investigations as they happen. So what happens when you doing what you enjoy to do, but it's a training program. It's not going to last forever. So right now, I don't know what I want to do for the rest of my life, but I'm very satisfied with my life right now, and I enjoy what I do. I'm with the Center for Global Health, and being assigned to global health basically means being open to whatever comes your way. You don't know which country you'll be, next week or next month, but the great thing is that in the end, whatever you do is helping someone's life out there. So for those interested in EIS, here's more information about program eligibility. So physicians with at least 1 year of clinical training, doctoral level scientists, PhDs, DRPH, health professionals, other health professionals with an MPH, like veterinarians and pharmacists, registered nurse, physician assistants, all these health professionals or scientists that are interested in epidemiology, there's an opportunity to apply for the program. So you can find out more about the EIS program. I put a slide here showing a link to the website, and just some general overview, a phone number and a fax number and an email address if you want to contact the EIS program directly. However, you can also email me. I'll give out my email later, but it's been wonderful talking to you all. Thank you.
Okay, wonderful. Thank you very much, Ruth, for sharing your insights and global health experiences. And again, just a reminder about the Q&A at the end. And so, Ruth, we look forward to hearing more from you during the Q&A a little bit later. And then let's go ahead and move on to our third panelist. Our third panelist is Ms. Temi Ifafor. She's a current fellow in the Global Health Fellows Program with USAID's Office of Population and Reproductive Health, where she is the technical advisor on health workforce and health systems strengthening. So Temi, welcome, and thank you for joining us. And I will ask you to share a little bit more about your experiences now.
Great. Hi, good evening, everybody. Good afternoon. I'm going to spend and split my time. I've got about 10 minutes with you. I'm going to spend the first 5 minutes talking a little bit about how I got here, specifically after grad school, and then I'll spend the next 5 minutes about opportunities at USAID. So, after grad school, I went to the University of Michigan and studied hospital management. I had absolutely no interest in doing hospital management in the United States. When I graduated, it was difficult to find those opportunities. I did, Ruth mentioned doing lots of coffee dates. I did coffee dates, and everyone said, you need to do the Peace Corps, you need to volunteer, you need to do the time. I didn't come from a financial background that really allowed me to volunteer. So I took a job after graduate school. I worked on quality improvement at a hospital in New York City and continued talking, networking, having coffee dates, doing information sessions just to keep in touch with what was happening in global health. About 10 months into my job in New York City, an opportunity came to do hospital management work with the Clinton Foundation in Ethiopia. That is what launched my international health career. Pretty much the first thing I wanted to let you know this evening is that regardless of what area of public health you can find, there's most likely that area of study available internationally. Just as Sarah Blythe had said that she had no idea an opportunity to combine flight studies with health and tropical disease would happen, the same thing with hospital management. I had no idea that hospital management would lead to an international opportunity. After I worked in Ethiopia for 2 years managing a hospital and health system strengthening project, I ended up in Panama. And there, through networking, I was running a 75-bed private hospital that was a Johns Hopkins Medicine International affiliate. The opportunity in Panama led to opportunities in Baltimore with Johns Hopkins. That also led to another opportunity for me to work in California with a health startup company that works with college students who are interested in learning more about public health, and also working with organizations like Kaiser Permanente to recruit students. So fast forward a little bit, and I saw a job opening with USAID that was looking for someone who was familiar with health system strengthening, familiar with hospital management, and familiar with health workforce development. And that's how I became a technical advisor at USAID. I will now spend the next couple of minutes talking a little bit about USAID, and I'm going to turn off my camera, and I'm going to share a document and then talk you through a couple of opportunities there in case people are interested in learning a range of possibilities that are available at USAID, both from undergrad, internship levels, all the way through people who have PhDs. All right, great. So I've started sharing my screen with you. Once again, my name's Temia Fafori. The great thing about working at the health sector in USAID is that there are lots of opportunities. USAID is a development agency. We give money to other countries to do the work on behalf of the US government. This means that oftentimes USAID is not always the one doing and implementing the work. USAID has two different branches. You kind of have USAID in Washington, D.C., and then you have USAID offices in every single country where we work. As you can see in my title, I'm in the Global Health Bureau. There's a number of bureaus at USAID. Some are global health. One, it does democracy, conflict, humanitarian assistance. You have bureaus that represent different geographical regions. Global health really covers everything from hygiene, sanitation, tuberculosis, to family planning, and HIV/AIDS. It's really dedicated towards, it's really disease specific. One of the biggest things that we're working on right now is an AIDS-free generation, as well as making sure that any person who is born can have the possibility of living a full, healthy life. So one of the things I wanted to talk to you about, I'm going to focus on a couple of different ways that you can get opportunities at USAID if that's what your area of interest is. As I mentioned earlier, USAID oftentimes it's a very big bureau, and they often recruit through lots of different ways. So one of the ways most people have heard to apply to USAID jobs is usaidjobs.gov. Unfortunately, that's a very big portal, and it's really, really challenging for people to hear back. So what my second recommendation is that if you're interested in working at USAID, then consider going through a third party or going through a contractor. USAID contracts with a number of organizations to bring on mid-level, high-level, and entry-level staff. The first mechanism that's really well known is they host a number of fellowships, one of which is the Global Health Fellows Program. If you're interested in global health, if you're interested in international health, both working here in the United States as well as abroad, the Global Health Fellows Program is one of the biggest recruiting agencies for USAID. Once again, they do not use USAjobs.gov. They have a separate portal, and I'll continue to encourage people to use these other parties and look for opportunities of organizations that recruit for USAID, or organizations that receive USAID funding. Both of those will provide you lots and lots of great experiences. So the other opportunity I wanted to tell you about was the American Association for the Advancement of Science. This is this is for people who have PhDs and have PhDs in things like chemistry, have PhDs in biology, who have PhDs in areas that are not necessarily public health. This fellowship has also been going on for a really long time. It's really well respected, and it's a great opportunity for people to get and learn and get their foot in the door about global health. So if you feel like you've already pursued one career and you want to start over in global health, then the AAAS fellowship is a good option. Another way that you can actually get into USAID is through the Foreign Service. That has a series of requirements. It's an exam that you take. That will put you, but it's a great career progression. That actually puts you working in countries, different countries, and you have rotations every 2 to 4 years. You can be a contractor. You can be a presidential management fellow. I'm going to share this document with you so that you have this after the call. If you're someone who's coming straight from undergrad and you realize that a lot of opportunities out there are already requiring that you have 2 years of experience, I would suggest we have a support initiative, and that this mechanism hires entry-level people. So if you're interested, you're just out of college, you're really excited, definitely try for one of the entry-level positions. Try for an internship. And an internship, there are oftentimes a lot of paid internships at USAID. You don't have to feel that you can't get a job because you don't have enough work experience. There's a whole range of opportunities that range from mid-level, entry-level at USAID. So just to kind of wrap up the things that I've learned in global health, I would say the first thing that I've learned in terms of helping me get opportunities, I would call it network or not work. Almost all of the positions that I've had have come through the recommendation or the suggestion of somebody who knew somebody. And I know that that's really frustrating, and network sounds like a dirty word, but it's not a dirty word. Networking is literally making sure that when someone sees your name or your resume, it stands out only because it separates you from being a stranger. So consider networking just opportunities to learn more about people and their life experiences. The other thing that I would recommend is find a mentor and find multiple mentors. You might have a mentor who is doing something that you like. You might have a mentor who's somebody that you respect. But I believe that all three of us on the call today would not have gotten to where we are without really strong mentorship and people who believed and encouraged us. The other thing I would say about global health, and this is what Sarah Blythe mentioned, is that global health is exciting. It's, you have people who oftentimes are doing work for 18 months to 2 years. This is my longest job ever. I've never had a job longer than 2 years, and that's just kind of the nature of global health. And so there's a certain amount of excitement and change, but then it can also be unsettling as well, especially for those who are trying to put down roots. The final thing that I just wanted to mention and just reinforce is that really figure out what's important to you, because global health will allow you to do that. So and I'm going to be really honest, if what's the most important to you is to make lots and lots of money, but you want to do it in global health, then chances are there's an opportunity in the private sector for you. If your goal in global health is to be on the ground and work with children, then you can do that. If you're interested in working in hospitals, then you can do that. Just really take the time to figure out what's important to you, and then if that is, then just go full force with it. I will stop here, and I will be available for any questions afterwards. Thank you.
Okay, wonderful. Thank you so much, Timmy, for sharing a little bit about your work with USAID and all the advice and different opportunities. At this time, I'd like to open up the floor to questions. I'm going to go ahead and turn on my camera, and I will ask the speakers. Hi, everyone. I will ask the speakers also to turn on their cameras as I pose questions. I'll ask all the questions right now are going to go to all three of you. And again, a reminder to everyone watching, we're getting lots of questions in via email and Twitter, so keep them coming. They're great. But to start us off tonight, again, this is a question for all three of you. A broad question, and I would ask that each of you speak. Each of you are working with different organizations and have had different fellowships. And so I'll ask each of you to speak from your specific perspective when answering this technical question. But we've got a question from Catherine McNamara, and actually many others also pose the same question. What are the skills and technical competencies that global health employers are looking for? And as a follow-up to that question, so given that a global health career requires competitive experience and these specific competencies, how does a new MPH graduate best sharpen the skills in preparation for going into that work? And so I'll invite any of the three speakers, feel free to chime in and take on that question.
Hi, it's Temi. I'll start. I will say that one of the big skills that I'm encountering that seems to be in high demand right now is monitoring and evaluation. I think in global health we are tasked with making sure that the investments, at least on our part, that the U.S. government is making and the money that we're putting towards different areas is showing an impact, that it's changing things. And there is a huge desire to be able to want to measure that, quantify that, and be able to tell the story of the great work that's being done. So I would definitely say a strong technical skill is monitoring evaluation. I will also say that program management is a good one. Being able to manage multiple deadlines, time management, dealing with people, I see those as being two specific areas that are very broad and very general, that are outside of some disease-specific knowledge.
This is Ruth. I would agree. I agree with Temi. Those skills are really important. Actually, in my job, we do a lot of program evaluation and a lot of monitoring and evaluation. Anything that you do, you have to check, is it working? And then the other thing that goes with program management is program implementation. The other thing that I need to add, I feel like whenever we talk about global health, everyone has this really sexy idea of global health. We're going to travel the world. But the other thing to remember too is that you have to be really flexible. And when I say flexible, I mean you have to be comfortable with being in a developed country this morning, and by evening you're in a hut somewhere with no electricity or no water. And you have to be comfortable with that. So it's not always easy. So like that skill, it cannot be, I don't know what skill that is, but if you can communicate that when you are seeking global health positions, your flexibility and your ability to work with people from different cultures and be able to respect their culture even when you do not understand it, that is a great skill. So whichever way you can communicate that is really great, because I think the biggest problem you can encounter is ending relationships that your organization has taken time to build with these countries that you'll be working in if you don't have if you don't know how to work with different people. Thank you.
Hey, this is Sarah Blythe. I would agree with everything that they just said, but I think also as far as skills that you need, you're talking to what, 3 MD MPHs who are probably pretty medically heavy and pretty epi heavy. The field is so interdisciplinary that I think, you know, there are any number of skills that you can bring to the field that are helpful and useful. Some of the things that I found are really helpful when I'm looking for somebody to join my team, or things that I've been asked about specifically when I'm doing job interviews and stuff like that, is first, you know, the language. Can you speak the language of, you know, wherever you're going? It's really important in a lot of situations. Sometimes it's not, but sometimes you just can't do the work unless you can speak the language. Secondly, analytical skills, epi skills, biostat skills are always helpful because they're, you know, a little bit technical and they kind of change over time as new methods are developed and whatnot. Also, if you know how to do things like tedious things that are necessary, like budgeting and procurement and that kind of thing, just the management skills and the you know, how to get things done. It's really important just to keep the show running. And then I agree with Ruth. I mean, flexibility is really important, and you're going to be in a lot of situations that aren't exactly comfortable. You're not going to be sleeping in an air place, or you know, you're going to have a mosquito net, or you're going to be miserable or not have running water or whatnot. And it's just, you know, really important to be ready for that if that's the setting that you're interested in working in. And then also, you know, getting along with people. I mean, people want to work with other people that are happy and good to be around and will help you and that kind of thing. And it's just like, you know, finding coworkers you work well with is just like, you know, making friends in a way. You know, you have to get along with everybody. So that's what I got.
Okay, great. Thanks, you guys. So on to the next question. Related to that, as far as competencies in getting that first position, we have a question from Olabisi Eddie that says, so what helped you most? What either skill or connection, but what do you think helped you most in getting your global health opportunity, the first opportunity you got right out of finishing graduate school?
Hi, this is Temi. I can start with that one. I kept applying. I got rejected or never heard back from a lot of jobs. And so what I would say helped me most is identifying what it was that I wanted, which was to work in global health, but being willing to be flexible in the sense of being able to be persistent when it seemed at times that was not going to happen for me. So as I had mentioned earlier before, I really wanted to go work abroad. I wasn't getting international opportunities, so I took a domestic position until a position opened up. And to be honest with you, that domestic position helped give me more credibility for the international position. So I would absolutely say the thing that helped me the most is persistence and just keep trying and keep applying, even when it seems really difficult at the beginning.
I totally agree with Temi. I did not apply to multiple jobs. I actually applied to the EIS program, but I think what helped too is that my background involved working already in international settings, so probably that helped as well. So yeah, but I think applying to multiple jobs is great.
Hi, this is Sarah Blythe. I agree. I agree with what's been said. I mean, I think, you know, you have to be flexible, especially when you're looking for your first job. And if it's not exactly what you want, then you, I mean, for me, it just helped to try to make the most of what I had. I mean, some of my first global health experiences were, you know, being a flight surgeon in Iraq and Afghanistan, and that was not what I was interested in doing initially. The last thing I wanted to do was go to a war zone with a bunch of Marines, and but it actually ended up being very useful. And I learned a lot there from taking that experience that, being outside of my comfort zone that I wouldn't have otherwise learned, and I think that was helpful.
Okay, great. Super helpful, everyone. Thank you. And so moving on to another question. Temi, you mentioned before about internships, and, well, actually more specifically about the financial burden, so therefore the financial inability to work for free. So we have one question about internships from Bethany Anderson. It says, how should I negotiate the transition from being an intern to having a full-time global health position? And then I'd like to also add on to that, this issue, we've had a number of questions, this issue of that financial strain and the possible inability to work for free as an intern, and maybe how each of you navigated that. So internships seem to be a great way to get experience when so many job descriptions ask for a certain number of years of experience. But I wonder if each of you could touch about that weighing working for free and internships as a way to get in the door, as well as the inability to do that.
Hi, this is Temi. So I would say one of the things to be pretty clear is to let people can't read your mind, and so let people know from pretty early on into your internship that you're looking to stay. That's one of the things that I found that was helpful. That will at least make sure that people keep you in mind when job opportunities come up. Some organizations do have resource constraints, and their internships very rarely turn into full-time positions. But I would say, one, communicate very clearly that you're interested in staying, and then set up with your supervisor some sort of goals that you want to accomplish in your internship. You'll have a much easier job proving your worth and kind of the value that you're bringing if you've set up some tasks for you to complete, and that you can say, listen, not only did I complete these tasks, I excelled at them. So you want to bring and add value to your employer, even as an intern. The other thing is, if it becomes pretty clear that your internship is not going to translate into a full-time role, then you need to get a paying job. And and that might be a hard realization, but it's not fair to you to continue to work for free or work in a position that's creating financial duress or hardships for you. So I would say that even as an intern, you should continue doing coffee dates, you should continue doing informational interviews. Use your network to the full extent possible. Use LinkedIn, use your graduate school networks, use your undergraduate networks, if you belong to a 4-H club, if you belong to a sorority, any network that you have, completely put a message out to them, say, this is what I'm interested in. So if you're in an internship, you never know who knows someone. One of my first opportunities in New York before I got my hospital job was working for the TB Alliance as an intern, and that did turn into a full-time job offer. And so just continue networking even as an intern.
It looks like we're talking in order, but this is Ruth. I agree with Temi. Keep networking, and if things are not looking okay, then I guess you have to look elsewhere. The other thing that helped when I did rotations or internships is having a product to take with you, something to show. So when you say you worked on this project, having something you take away, maybe a manuscript, or if you wrote something hard and that you can show to your employers when you're looking for jobs, that hey, this is what I can do, so they can see it. Or and when you're doing the internship, it helped to volunteer for things, even if things, projects that were not handed to me, but to when I hear of something interesting that I can do that is more practical than just sitting at a desk doing something, I would go do that, because then you have all these little other skills that you didn't think about, but someone else might find them really important. Okay.
This is Yeah, we definitely have established our order now. But yeah, I agree with what's been said as well. And you know, I did the health profession scholarship program for medical school. It was a little bit outside of my comfort zone when I was initially signing up for it. I think that's, you know, kind of the hard thing when you're trying to make that transition and you need to get paid. I mean, I think you just have to apply to everything and see where the opportunities are, network, and then be willing to kind of do some dirty work or, you know, do something that's outside of your comfort zone. Because first it could teach you something, and then secondly it could turn into something else, or you may discover that you like something that you didn't know that you would, you know, find enjoyable. So I think you just have to be really open and flexible and assess what your priorities are and then really go after those priorities.
Okay, great. Thank you. So I want to turn the tables a bit because I think we have a few viewers who are not from the U.S., who are from elsewhere, who are possibly studying here in the U.S. now. So I've got a question from Kadir Saeed, and it says, so how could a public health professional from a developing country establish a career in global health in the U.S.? We've talked a lot today about U.S., presumably U.S. Graduate students going abroad to work in global health. And Ruth, you may, having studied in Uganda, you may have particular insight into the reversal, so coming from a developing country to the U.S. to work on global health.
Yeah, that's a great question. It's when if you're from a developing country, there's some challenges that may be different for you. I face some challenges. I'm a physician by training, so if you're a PhD, I'm not sure how this works, but when you train in medical school in a different country, when you come to the United States, it's really important to do the boards that are necessary to get into residency, because you need a residency training to be seen as an MD, and getting a job in global health without that can be really difficult. So it's not enough to get an MPH before you can get a job in global health. You have to have that doctorate degree, either PhD or MD, or if you don't have those, maybe you have a lot of work experience that can compensate for those. But yeah, that goes a long way, and it's during these training programs, you know, residency or PhD programs, that you meet key people that can direct you along the way. That's when you make the connections that are important for that first step in global health. But you know, if you want to, you know, talk more, you can email me later. But yeah, if you want a more specific explanation. But for international students, you have to put in a little more effort. But the good thing, your international background is also an asset. You do not hide that. You put that on the front and say, I've lived here, I've worked here, this is the work that I did in these countries, and that counts as well.
This is Sarah Blythe. Ruth really hit the nail on the head, but just to add a little bit, I know that some programs like NIH Fogarty do have a LMIC component where they support students and postdocs who are from low and middle income countries. So tapping into that network, and I'm not sure about programs in state or some of the other organizations, but they're out there. You just have to look for them a little bit. So.
Hi, and this is Temi, and I think the last thing I would say is, and this goes back to something Sarah said earlier, there's a lot of room for people who I'm going to call our cultural ambassadors, who can both understand and speak, either have language skills that are important, whether that's French or Urdu or whatever the language is. I think that there's a huge demand for people who kind of have high levels of cultural competency and can be, you know, function as cultural brokers. The other opportunities that I've seen, and this is specific to USAID, is that we have a number of partnerships with people and with private organizations that are looking for people from the diaspora who might be interested in working for a U.S. organization but back home. So, those are kind of the two opportunities that I've seen. But I also feel that here in the, especially with organizations who are implementers for USAID, a number of organizations are willing to take on the visa expenses, especially if there's a special skill set, and that could be language, that could be cultural knowledge, that could be, if you're an epidemiologist and you have a highly technical skill, there are a number of public health organizations who would be willing to take on an international person.
Okay, great. Thank you so much. And we've got just a bit more time here. I would recommend attendees get your pens out. A few of you have asked questions about, so what are some of the good platforms for finding global health opportunities and jobs? What websites, specific databases have lists of open positions? This is kind of a joint question from Ian Imbert and Eleanor Delore. And then also to add on to that, as far as recommendations for specific sites from our panelists, I wondered if our panelists could also touch upon what, or do you use different job search strategies for a global health job than, for example, searching for a job in another field? And that question is from Samuel Matos.
Hi, this is Temi. I think that there is a number of organizations, and and once again, everything that I say is USAID focused. USAID's biggest recipients and people who we work with very closely are organizations. I'm going to name a few. One is Management Sciences for Health, MSH, they're known as. They do a lot of healthcare consulting. We've got IntraHealth International. We've got John Snow, MISO, Partners in Health, the Clinton Foundation. We kind of say this in DC. They're called the Beltway Bandits, and those are those are organizations who, about 30 years ago, USAID put a lot of funding into building their capacity, and now they are the biggest recipients of USAID money, and therefore these organizations are constantly hiring. They're constantly looking for staff members to support their programming. They work all over the world, and they work very closely with donors. I would also say that, if you're looking for opportunities, I'm happy to send out the list that I shared earlier in my presentation, but don't feel that you have to work directly with a donor. Don't feel that it has to only be the World Bank, or that it has to be the UN, or that it has to be USAID. There are a whole host of donors out there that are doing lots of different work. I would say, if you're interested in health, look at health from a number of perspectives. You can do health from a water perspective. You can be an engineer. You can be a city planner and still do health opportunities. And so, the beautiful thing about public health is how flexible it is. And so I would definitely encourage people to look at non-traditional paths. You have a lot of social entrepreneurship happening right now. You've got people like the Gates Foundation that are funding young and energetic people. You've got organizations who are sponsoring hackathons and looking for people who are computer programmers to be able to create health apps. So try to also think creatively about health, and don't think of health only as this disease, but really start to think broadly about what does it take for a health system to function. So you can be a computer programmer and just look at it from a different angle, and I think you'll find a huge variety of opportunities that way.
Temi, that's excellent. I don't know if I can add much more to that. I think one important thing to remember is that even though you want to work, with whichever organization you think of in the global health field, it's important to remember that it's so interconnected. Global health is really small. It looks big, but it's actually very small. So wherever you're working, just network. I cannot emphasize networking more than a website, more than sending in an application somewhere. just talk to people, use LinkedIn and reach out to people. And then the other thing is, like Temi said, health is broad. Think of, the pharmaceutical industry, think of engineering, think of food, think of water, anything that you can think of, whichever organization, just check if they have a global perspective. It does, XX company that's domestic, does it have a branch that works globally? And then tap into that. So whichever, whether you end up with like a rotation at a health department or at a company, just talk to them and ask them about their interaction at the global level. And in that way, you expand your network beyond the traditional ways of going to a website and clicking on a button. That works too. I mean, you should do that as well, but there are these other ways that no one thinks about.
This is Sarah. I don't have a lot to add to that. As far as specific websites, specific databases, I mean, check with any if your school has any kind of career planning or counseling services, I would check those out. In addition, for me personally, I went through the NIH Fogarty Consortia. There are several consortia across the U.S. That focus in on certain institutions, but you don't have to be affiliated with those institutions in order to apply. Look at Fulbright. They have a student program, they have a scholar program, they have programs for faculty. So when I was asked to come to West Africa, I got, I sent my CV through the Office of Foreign Disaster Assistance, and ended up getting requests to send my application to Partners in Health, to International Medical Corps, to the Irish organization GOAL, and some other NGOs. So yeah, just keep your eyes out and be flexible. That's all I know for specific databases.
Okay, great. Thank you. I hope that was helpful, and I hope you guys have your pens ready. But with that, it is almost time. We're almost out of time for the night, so I want to go ahead and wrap things up. Thank you so much to our panelists for your honest and insightful answers, and very much so thanks to the attendees also for your great questions. I think this was a great discussion tonight. And not to be concerned if you weren't able to see the PowerPoint presentations, or if you know people who are interested in this webinar topic tonight but who weren't able to join us, keep an eye on your email inboxes, because we will email out both the link to a recording of this webinar that you are free to share with others possibly in your program who may be interested in the topic, as well as we'll have the presentations and the resources that our panelists shared tonight. We'll get those to you all via email. And also do check our IHSC International Health Student Committee Facebook page, because we'll post the link on there in case you want to rewatch or share this webinar. And with that, I will pass it over to Margaret Pichardo, our co-chair of IHSC, to close us out for the evening before we finish and close out this broadcast. So, Margaret?
Thank you, Anna. And thank you, everyone, for participating. Thanks so much to our speaker conversation. I think it was extremely informative, and definitely there's a need for these type of conversations to continue. And as a student committee in international health, we'll be sure to continue inviting young professionals and newer professionals in global health to these types of conversations. So please stay tuned for our next webinar in the late spring, which will follow on in a similar topic. Very much to Anna for moderating the call today, and to our career development team, Sharon, Mary Carol, and our social media team, Stephanie, for answering questions, keeping track of our Twitter accounts and Facebook and email account. Again, everyone, thank you very much for being part of our webinars. Please stay tuned for our upcoming one. And if you are interested in getting involved with our International Health Student Committee here at APHA, please find us on Facebook, send us an email, and we will send you our call for position, which will be opening soon. And be sure to join in and stay tuned and have a good night. Thank you, everyone.
Thank you, guys.